So here comes that moment. So the winner of our first annual Residency Rescue is Dr. Conrad Fisher. But as Dr. Conrad Fisher pointed out, this has been great and it's been fun to see the specialties kind of duke it out together and really see like what they are about and what it means for each of them to do what they do. But it's true, exactly what many of these individuals pointed out is that we have something that's really coming. And we need to do something about this. The true fact is that you can do something about this. Now, with us today here to tell us what we can just begin to do about this issue of cuts to graduate medical education is Dr. Charles Rothberg. Thank you.
Congratulations, Dr. Fisher. I'm not sure how anybody could possibly follow him. I really enjoyed the presentation. You have a really stellar panel. Let's hear a round of applause. Well, my first impulse in watching this was, wow, did this really have to happen? Did you have to, vote some programs off the island? Instead of having this debate and these arguments, could instead the debate have been reframed? In other words, why do we have to say graduate medical education cuts, or any issue that affects our profession, is coming down the pike, and then we are forced to respond to it? Is there a way to cut the line and say that these cuts are inappropriate, which I think was the message that was delivered by just about every one of the doctors. Every one of them said, from the perspective of their own specialty, that wellness ultimately reduces costs across all of the specialties. Every one of them alluded to or mentioned that a cut in services would result in a loss of the most cost-effective practitioners, and again, a cut in services to the community. And the other thing everybody said is that everyone's an internist. And I am an ophthalmologist. But a 4-minute PK, I don't know. Has anybody here heard of game theory?
Yeah.
Thank goodness. Does this evoke the prisoner's dilemma? I mean, if you think about it, you basically tell all these panelists to go and defend their own position. And of course they did a fabulous job of staking out their own claim, but they didn't realize that had they collaborated with each other, they would have had a better result than a functioning one. There were 4 losers at this table. And I'm not even sure that the winner really wins when he has to practice in a vacuum. He told you how he has to give up his paycheck in order to keep his hospital afloat. Once that paycheck is gone, what will he give up next? I guess I don't have to explain game theory if you raise your hand. My feeling is that, just like game theory, our profession is being exploited. We're being divided. We're being asked to fend for ourselves. And that divisiveness doesn't allow us to collaborate, which is where the real solutions lie. And I think that the other healthcare stakeholders, whether they be the legislator that's not responsive to Dr. Fisher, or whether they be the insurance company that doesn't want to pay your patient's claims. Has anybody seen the governor's report on surprise medical bills? If you read the report, or at least the executive summary, you would be under the impression that patients are being gouged. But we've seen this before with the Ingenix settlement that this governor, when he was Attorney General, negotiated. And what they found was that even though people thought the doctors were gouging the patients, it turns out it was the insurance companies that were gouging the patients and framing the doctors as the villain. Why should funding be cut at all? Why should, has anybody here heard of SGR? All right, essentially, that's a limitation on reimbursement for physician services. I haven't had a pay raise. I see largely an older population, 10 years. What does that portend for somebody that wants to take over or follow in my footsteps? If you're going to be earning, when you start on your first day, what somebody should have earned 10 years ago, but yet all your costs of doing business, buying a house, doing all the things that people need to do, are exchanging $2012. Why should the students that undergo clinical rotations in New York City have to leave the state to do those rotations while students from non-accredited schools fill the spots right here? game theory, and instead of being the prisoners, we should play the role of the inspector. And the mechanism exists for us to do that. And I'm going to put forth the Medical Society as the mechanism. I've been a member for many, many years, like Dr. Rosenblatt, I don't like to admit how many. But the Medical Society for me has provided a venue for me to pursue advocacy for our profession. I've made some friends, or at least people I know. And I think that we have a group of students that I see from the medical student section that have remained active after the first and second year of medical school, because I really think that they buy into the vision that collectively we can make a difference. There's all the rage in the hospital to integrate our clinical side, and I think there's no reason why we shouldn't be integrating our advocacy side as well. If we're divided, you're going to see what you saw on the panel, which is 5 very, very strong, well-intentioned, hard-working people with only one survivor. So my suggestion is, and I think you have a website that we can put up.
Already did. Just put it up.
It's online.
Message.
Oh, I'm sorry. And I think I hear Aretha again too. You ready? You put up the site for the PAC or for the medical? Okay. MSNY PAC is an advocacy organization. For the students, it's a great deal because it's $10. And if you sign up, here's the deal I'm going to make. I would pay your PAC dues for the first year, me personally. If you sign up and become a MSNY member, and that's, you can be a MSNY member and an AMA member for $84 for 4 years. And I think that's a great deal because you get 2 journals, which I don't think you can buy online for anywhere near that for 1 year. So you can get JAMA and a Specialty Society journal. And if you can swing it, I know student budgets are tight, it's a no-brainer. Just do it, and you'll get access to all kinds of information, advocacy, specialty, what you want to do for a living. On the state society level, most of you folks I expect live here in New York County, and even though that's the evil county that Dr. Rosenblatt runs, and Suffolk is much better, they are absolutely resourceful. They're very welcoming of the students and young physicians, and I think if you attend some of their meetings and some of their other events,
If you can travel that far.
You're not going to try. You will find a very welcoming group of men and women that share our vision for this profession in the future. And I would recommend that you go down there, and I expect you'll be seduced by what we can accomplish in the profession. Again, I don't want to stage Dr. Fisher, so...
Well, actually, I want to say something on that. I was a student member in MSNY.
Dr. Fisher, can you come?
Can you come to the microphone?
When I was actually when I was a resident, I was the head of the resident section. In 20 years ago. So and the main thing is that people self-select for the people who want to be the next phase of leadership for the state and for the country. And the interesting thing is, it's very gratifying for me to look at the people who are even in the student and resident section, and for me to open up JAMA, and for me to open up Internal Medicine News, or open up Annals of Internal Medicine, and look at the editorial board on the major journals and say, oh wow, is that the person that was like the 25-year-old person that used to sit around at the resident section? Oh my God, look at that. You see what happens later on. So I think that's an important thing to go into some of the MSNY meetings and to join the student resident sections and go see what it's like. And what you really do is you meet the next phase of leadership for the country. Because you see, you probably don't know when you're a student, you don't understand that the state society is like MSNY. That's what, if you take all the MSNYs and the other 49 of them, that's called the AMA. That's where it all comes out to. So anyway, I just think that that's it wasn't clear to me beforehand about this, but I think that that is an extremely important thing, mostly because it really doesn't matter, because 25 years ago, who would have known what would go on? Now they're running the journals, and I wouldn't have known that I would be like the residency director a couple times, and then it doesn't need that many people to change it. Right? I'll also tell you that one of the reasons healthcare reform succeeded this time and did not succeed 20 years ago is that 20 years ago, the physicians were against it, and the physicians' organization didn't support it. So that the government and Clinton could not go against stupid people, insurers, and the doctors, and the pharmaceutical companies, and couldn't go against all those people. And I am certain that the reason that it went through this time is very strongly because not only do we not oppose it, we supported it. So if we're not going to get a raise, at least let's not get a raise and insure everybody. You know what I mean? All right? So I actually, personally, I think that in America, you get to save the world and be rich. I don't think it's neither or.
I'm with you.
Yeah?
Any comments from our panelists? Any comments from the audience? I'm happy to answer questions. I think debate is awesome. But I think you have to, get involved, get connected, pursue your interest, and it does make a difference. Those legislators, I expect to see Dean Sellers tomorrow night at a fundraiser, and he's going to hear that message tomorrow night. If you heard it 50 or 100 times, eventually they'll have to respond. That's a strategy that we have in Suffolk. We have what we call institutional memberships. We have entire medical staff join the medical society. So in one little block, I've got 1,000 members that basically has an entire congressional district with 1,000 doctors. It has entire assembly districts, Senate districts in New York State. It's very hard for these legislators not to at least listen to what you have to say, let alone try to support the legislation that you'd like to see enacted. And it's the power of numbers and the power of voices that is really important. You might say, well, gee, I'm a student, I'm still studying physiology. I've been the advisor for the medical students now for about 5 years. And people ask me, why do I do that? And the answer is I looked around at all the people that get Nobel Prizes, and they all look like me or these guys on the panel with gray hair or no hair. They all got the prizes for work they did when they were your age. You guys are all the guys with the great ideas. And I want to be immersed in that. I want you guys to join. So anyhow, to join the State Society, I paid PAC dues this year, but you got to let Jim Wilkes know that it goes on my tab.
If I join, will you pay?
No,
The
you're so
only other-
expensive.
The only other quickie that Charlie left out,
Uh-oh.
when you get an email
I left out a quickie.
and it tells you to go to one of the websites, do it. Because MISNY and the AMA both have these great websites that will send letters or emails to your congressman, your senator, your assemblyman. It must take probably the first time it may take 30 seconds.
At least.
And then once you're in there, you tell it to remember who you are, and the next time you go, it'll take 2. And since I see all of you with these wonderful smartphones, do it.
It's called CapWiz.
Right.
Okay? It's called CapWiz, and it creates a nice letter that you can customize, but don't bother. And it's to support your issues. It sends your legislators the message that this is
And they
important.
count them.
Yeah.
So Dr. Rothberg, sorry, I just a quick question.
That's okay. We're brothers and sisters.
So, I mean,
I still.
you just touched upon one thing that we as medical students can easily do that takes no time, but what would you say the most important thing for medical students to do is regarding, securing funding for our residency programs, which is essentially our future and why we went to med school in the first place. So what would you suggest medical students do at this point?
Can you repeat the question?
The question is, what's the most important thing medical students can do to secure funding for their education? And my answer, self-serving as it is to join the AMA because that's AMA policy, and that's what makes a difference in the Congress.
Great question. I'm going to add to what Charlie said. One of the ways I'm different than some of the psychiatrists, the psychiatrists stereotypically are passive. We take everybody and everything as it is, and we move from there. I certainly can do that, but I also believe we need to be more proactive, not just in psychiatry, everywhere in medicine. You need to be a member of MISNY and a member of the AMA, but you need to do something with that. You need to take action. You all have cell phones and can do this faster than I can. Put this phone number in your cell phone now. This is for the Assembly switchboard in Albany, 518-455-4100. This next number will be for the Senate switchboard in Albany. All right, I'll go back to that one. Assembly, New York State, 518-455-4100. The Senate. Whoops, sorry. I just called someone I didn't mean to call.
Senator Scala.
I don't do as well with a smartphone as I'd like to.
Okay, which one you need?
Senate switchboard, 518-455-2800. Make the call. When you get that email, email. in addition to that, ask your classmates, ask your friends. You're sharing a house with people who are in other programs, ask them to make a call. How many of you are from New York State or have family in New York State? Ask your parents to call, your brother, your sister. Call their senator, their assembly member. All the fundraising and joining the PAC, joining the AMA and this and is very important. But the money is all about votes, it's about re-election. So few people take a minute to call. I'll tell you what I do. I call my senator, my assembly member all the time. I call others from Suffolk. That's why it's in my cell phone, Bluetooth. I'm running from the hospital to the office to the clinic. And I make a call on one of the issues. It doesn't take long when you do it that way. You do it in your downtime. And it makes a big difference. Tell them you're a citizen, you're a student, you're the future of caring for their constituents, your future patients, and you vote. And then follow that up. And when you vote, keep in mind where they are on health care. Because if we don't have our health, we can't fight for anything else. And that's not just as doctors, that's as citizens. It doesn't take a lot of time. It probably adds up to about 15 minutes a month. Maybe an hour a month in May and an hour a month in June, when most things happen in Albany, after the budget is finally done, around April 1st or thereafter. And then, 15 minutes here and there over the course of the month. So join, but take action. It doesn't take a lot. And we tend not to call, we tend not to write. We have to be louder, and we have to be one voice.
For people who have never called before, can you give an example of something that you might say on?
Perfect example.
Repeat the question.
The perfect question. The question was, for people who've never called before, what might I say? Okay, I'm Frank Dowling. I'm a medical student at X University. I live in your district, and I vote. I have family in other counties, and you ask them to call. There's a serious crisis with graduate medical education, and I want you to take the lead and co-sponsor, if you haven't already, legislation to fix this dilemma. And I want you to push this through. And I want you to know that I have X number of relatives in New York State, and I'm asking every one of them to call their senator, their assembly member, and to vote against their senator or assembly member, and that means you too, if you don't do this. And if you do this, I'm asking them to vote for you. That's about all it takes. An issue of collective negotiations comes up, or the issue of this out-of-network legislation that we want to fix this dilemma that patients can't figure out what their coverage really is. That's important legislation. You're basically saying the same thing. Here's the legislation, maybe you give them the bill number. I'm calling in support of it, and I will remember when I vote. I'm a student and I vote, and I'm asking my housemates to go along with me. I'm asking my family and so on. And you ask them to do the same thing. I do this with my mother, I do this with her sisters. A couple of them live in Senator Hannon's district. Their names are now known by staff who call the office just because they're kind enough to listen to me, because I asked them to. That's what you need to do. And you know what? If you're doing that as students, and you share that with the faculty you're working with, who probably don't call and don't email either, they may start making calls, and tell them, you're teaching me, do you want me to have a future? Will you make the call, and so on. A little bit here, a little bit there, and then finally it tips.
I think that the reason that it becomes difficult is they need something very concrete and specific.
Right.
So, I'm sorry, Charlie is going to see Skelos tomorrow night, right?
Well, it's a free meal for me.
Yeah. So the issue is this. This is the guy's name. He is in the Senate.
He's the majority leader. He's more than in the Senate.
He is the majority leader for the Senate. That makes him the equivalent of the Harry Reid of the state of New York, if one knows who that is. You, ready? If Charlie's going to see him tomorrow night, and you make this phone call tomorrow, and you say, and you know why it's very interesting about having a medical student do this? Because when you go and you make this call, you are perceived as being, having no ulterior motive. See, when my CEO goes to Albany, the legislators go, yeah, you want money, right? And then you give yourself a raise, right? Get out. But you see, you're perceived as being innocent, as you know, you got no ulterior motive. So you go like this. Hi, I need Senator Skelos' office. Hi, I'm supporting now, this is where you can give them, as an experiment, one thing to empower them with as an idea. For instance, I could say to you, the senator needs to have a plan. Now the problem is, it's not like normally you call up and say, I want the senator to vote on this bill to pass this. But the problem is, they're so disorganized about the hospitals up there that there is no bill to support. There is no plan. But you can say something like this as an experiment. If 25 of you call tomorrow, and that senator got 25 phone calls from medical students that say, I'm very upset that there is no plan to save the hospitals in New York State, and I'm supporting the Medical Society of the State of New York, and I insist that the Senate Majority Leader, as the leader of the State Senate, put forward legislation to save the hospitals. And 25 people call, or even 20, I guarantee you they will hear that. They will hear that. And when he sees him tomorrow, he'll be like, oh, what'd you do? Like, would you like to switch to decaf, please? You know, what did you get? Like, you refilled your testosterone prescription? What happened? Okay, you know, something like this. No, don't take it like that. You know what I mean? Don't take it like that. But I'm just saying is that you will empower this man to be able to be more forceful with the state senator if he knows I'm talking to a person that has a constituency that votes. So you want to make a call. Okay, I'm calling. What am I calling to do? Hi, how are you doing? No. I want to speak to this guy's office, and my message is this, we want the senator to put forward legislation that meaningfully saves the hospitals in New York State. Okay?
Awesome.
Rob's going to make his closing remarks, but I wanted to point out that each school here has a chapter and a chapter president. And if you're really interested in doing that kind of organized lobbying, the chapter president, we can give you turnkey programs on how to phrase these things. One of the beauties about being part of an organization like the Medical Society of the State of New York or the County Medical Society is that you have staff. And staff prepares things in bite-sized pieces for you to deliver, so you don't have to be able to discuss the nuances of every piece of legislation because you like it. You can just call up and say, you know, I like this, and the message is populated, they understand. So it's really an awesome thing to be a part of.
This is how PIPA and SOPA got beaten.
Yeah.
The internet legislation,
So-
that's what killed PIPA and SOPA. They provided the numbers and they gave them a phrase. Kill that bill, and it got killed.
It's awesome, but you got to be in it. Thank you very much for the opportunity. This is awesome.
So we are medical students, and we hear these things, and yet we still sit on that side of the table. And I'm still hearing a little bit of, cynicism in my own head even. Like I feel like I'm just going to call, and it's just not going to mean anything, and it's just going to be time that I wasted not studying. That's the excuse that I always gave myself. But my first year of med school, we actually heard that they were going to extend the number of years it took to get our license here in the state of New York by like 2 years. And I, like many of you, have outstanding student debt. And I actually plan on moonlighting when I'm a resident somehow just to help make up that difference in money. And I thought it was ridiculous that I wouldn't be able to do that. And I didn't know what I would do about it. And frankly, the majority of my colleagues didn't know about it. So we circulated a survey, and 10% of the medical students in the state of New York responded and said that this is ludicrous. If I have a choice between going to a residency program that allows moonlighting, like in other states, or staying in New York and not being able to make money on the side so that I can pay my debts, I'm going to go someplace else. Well, it was that survey that your student section, that your medical society put together, along with the eloquence of leaders like you just see here, who were actually able to lead that. You don't hear about it because we did it, and it worked, and we don't have to worry about that problem. But the point of the matter is all of us really do have the power to make this difference. It's just a choice. Whether or not you're going to pick up the phone, whether you're going to click a button, that's all it comes down to. And it could be very much that we're in the situation we're in because we are responsible for not doing that. And we don't just owe it to ourselves and for our interests as a profession, because our interests are our patients' interests. And if they're not going to have the opportunity to see a doctor because I didn't click a button or I didn't call Skelos, then I'm responsible. So I just want to thank all of you here for being these audience. Thank you more than anyone because you are actually making change possible. And I think we really owe another round of applause for our contestants. Thank you to the AMA chapter here at Columbia for making all of this truly possible as well. And everyone have a wonderful week.